All right, June. I think I'll let you get things started, and as others come in, we'll welcome them.
Okay, sounds good. Well, thank you very much, everybody, for taking the time to join us this afternoon. This is our third webinar. What we do is we choose a topic that hopefully will be pertinent to you as you move through your screening initiative with ASaP. And today's topic is measurement and run charts. And Mark Watt from our Lethbridge office is going to be co-presenting with me, and I really appreciate all of his technical help. So are all of you signed in now through GoToMeeting so that you have Mark's slide deck showing on your computer screen? I'm assuming everybody does. Okay, Mark, if you wanted to go to the next slide. So I've listed the objectives, so hopefully at the end of this webinar, you'll be familiar with the different types of measurement, be able to apply measurement to different phases of your process improvement journey, be able to construct a run chart, and be able to identify changes in a run chart and identify improvement. So I'm going to turn it over to Mark for the first section of our presentation.
Great, thanks, June. And just as a reminder, because this is a relatively small group, feel free to, we invite your questions. We may also ask you to use the question bar on your GoToWebinar, and that is located on the right-hand panel. If you're having difficulty seeing some of your screen, you may wish to minimize that panel by pressing the red button, which looks like a red rightward pointing arrow. And that may help you see your screen a little bit better as well. Throughout our presentation today, we have, I heard a question about pop quizzes, and in fact we do actually have a couple of pop quizzes that we'll conduct today as a part of our PDSA around trialing some new technology. When those come up, you'll be invited to respond to the questions by clicking on the appropriate answer. Your answers, I believe, are anonymous, and we'll just try to get the group thought on some of these answers. So with that, I will move us into starting to talk about performance measurement. With measurement, we know that there are several different kinds and different purposes, and so for the discussion today, we thought we should just identify what are some of the different types of measures and which ones are we going to be focusing on primarily in our discussion today, as well as throughout the ASaP initiative. The first measurement that we want to talk about is measurement for accountability. And this is a particular type of measurement that is used when you want to record or report what has occurred. And generally the outcome of that is an external party wants to know what happened as a result of an intervention or an outcome. The next type of measurement is a measurement for research, and that's the type of measure that one would use when they're looking to discover new knowledge. So you have a question about which is better, A or B. You would use measurement that would be with a research focus. Today we're going to be talking about measurement for improvement. And this is a different type of measurement which seeks to bring knowledge into practice. So looking at knowledge that already exists, and how could we bring that and apply that in a way to generate a form of improvement.
Oh, did someone just join us? It's Christine. Well, hi, Christine. Thanks for joining us. We only just got started, and Mark is just starting his presentation. Okay, thank you.
So through our journey through ASaP and other quality improvement initiatives, we will find that our improvement teams may require measurement through their journey, and there are particularly three times or three areas or three stages that measurement may play a very beneficial role. The first is around developing ideas for improvement. So sometimes we would be looking at a measurement strategy to help inform which ideas should we be pursuing for a test of change. The next, for a team to pursue for a test of change, the next area that a team may look for assistance is around a test of change. How will we know that this change has made a difference? And this is one of the areas of measurement that we focused a bit about in our training session. And then in our last training session, we've talked about the idea of measuring for implementing a change idea. And so taking that change idea and using it for either for spread or for a broader implementation beyond the initial testing. So when we're looking at measurement and the model for improvement in our PDSAs, we often talk about describing what the measure would look like. And in fact, it's very beneficial if we describe our measurement plan in our improvement activities. And so a measurement plan can have lots of different detail, but I've listed some of the common features that, that we would want to consider. So the first one is around the purpose of the measure. So we've just talked about, is this to develop ideas? Is this to test a change? Or is this a measurement around implementation? Generally, the type of question that's being asked by the improvement team will give you an idea of what is the purpose of this measure. Very often we'll want to know what is the type of measure that we will be conducting. Is this a process measure, which is what did we do or what are we doing? Is this an outcome measure? What was the impact of our action? Or is this a balancing measure? Did we affect something besides what the initial test was looking to affect? We'll want to create operational definitions, so when we're trying to describe our results, we're very clear and precise around what it is that was being measured and what was not. And the what was not comes in the form of describing the exclusion criteria or pieces of information that would not be part of the measurement plan. The measurement plan would also need to include your data collection and sampling method. And that is relatively straightforward in terms of who's going to do what and when and for which. We would expect a measurement plan to also include the goal or the target, or sometimes it can even be a prediction of what that measurement will generate. There is a concept of stratification, and particularly when we start to get data that has more and more data points, it may be particularly useful to be asking, does this information have a natural breakdown point? So for example, if we start to look at multiple providers or multiple clinics and we're investigating or we're trying to report on some outcome or process measures, there might be some stratification based upon types of service or provider type that would be important to include in our measurement plan and report those somehow separately. We need to include, where is our data? What is the data source that we will be generating this from? Is this a new data collection and it's a new data source, or is there a mechanism already in place to pull this data from? And one piece of measurement plan that sometimes tends to get overlooked is, when is the conclusion of the measurement? Is this a short measurement where we're going to develop some change ideas? Is this going to be a longer measurement where we're actually testing? Or from an operational and implementation standpoint, is this going to be a very long-term measurement? Important to be bringing that forward up front so you can identify the resources that would be needed. I'm going to pause there for a moment because we're going to change gears, and really for the rest of the presentation, we really thought we would focus around an applied component to understanding measurement and run charts. And many of you may have been introduced to the Blue Meadows Family Care team, and this is a case example that we've used through our training, and this particular example follows them through some of their measurement ideas. And the first area that they wanted to focus on was developing some ideas, or that's the focus of the measurement. This improvement team was very curious as to why their patient screening rates were lower than they had expected after receiving their chart review. During one of their improvement meetings, it was discovered that their patients do not regularly see their own primary care provider. And so the team decided that they would try to figure out why this was occurring. So they formulated a question of why are patients not booking appointments with their own physician? And they created a measurement plan that included Maureen would record the reason why a patient was booked with an alternate provider, and she was going to measure this through 25 patients during the following week. Their measurement plan included a team prediction, which is that most, in fact, are seeing their own doctor, and for those that don't, it's usually related to the patient having some urgent needs. Maureen returned to the improvement team 1 week later with her results. 13 of those of the 25 that she looked at did in fact see their own provider. 7 had an incorrect provider listed within the EMR. 4 records, 4 patients saw another provider because of an urgent need, and in one case there was a patient request to see a different provider. So presenting this to her team, she generated the chart that's on the bottom of the page. And so we're going to put a pop quiz up for you to identify what type of chart is Maureen depicting. Is Maureen demonstrating a Pareto chart? Is she demonstrating a box plot? Is she demonstrating a histogram? Or is it a line chart? And just a few more seconds. I see people are responding. That's excellent. All right, well, with about half of us voting, the sample that Maureen is showing is actually a histogram, which is describing the frequency of her responses. The Pareto chart is another choice that she could have used, and the difference here would be a line that would indicate the cumulative total of those responses. So if you had selected Pareto or histogram, those would generally be accepted as the preferred, whereas box plot and line charts are indeed other forms of charting, of presenting data through a chart.
I guess this is Nolan here. Just to be a stickler for definitions, a histogram would have a numeric base as opposed to a nominal or ordinal base. So it's not technically a histogram either, but it's more of a frequency chart. Sorry to be a nerd, but...
No, you're correct, Nolan. As I was putting that up, I was like, this is really, I should have had a none either, but you are correct. And maybe that's why some of you refrained. Maybe that was the correct answer. So when these results were presented to the Blue Meadows family care team, the results, they were surprised, in fact, to see that that had been a change that was related to their EMR, because this is a team that had participated in PDI and AIM, and this was they'd assumed that this practice was relatively well implemented. And so they suggested that they would do a PDSA for updating the primary physician in the primary physician field in the EMR. And they created a PDSA question. Can we increase physician continuity by regularly updating the primary provider and encouraging booking with the primary provider? So this was a larger PDSA, but Maureen was going to create a measurement plan that was going to sample 5 records per day to determine if the primary provider was updated at that visit. So using sorry, all just running through the technical glitches of all of these. So with Maureen's measurement sample of 5 records per day to determine if the primary provider was updated at this visit, what type of measure is Maureen trying to depict? Is she depicting a process measure? Is she looking at an outcome measure? Or is she looking at a balancing measure?
Mark, we have written on the side there that Lori and Nandini have questions.
Great. I will just close this, and I didn't see any questions come through, so we'll pause here. And Lori, question.
That might have been incorrect. I did not have a question.
Okay, great.
Oh, Nandini, did you?
I don't either. Sorry.
I wonder if they were trying to vote, Mark, and that's how it came up on the screen side.
Yeah, we just voted. So.
Ah. Excellent. Well, thank you for your votes.
You're welcome.
The type of measure that Maureen is looking for here, or that is being depicted by Maureen sampling 5 records a day to determine if the primary provider was updated. I had as a process measure because this was a measure of what they were doing rather than the impact. If we were looking at the question that was being provided, which is whether or not the patient was booked with their primary provider, that would be more demonstrative of an outcome measure. And so I'll pause here to see if people had other thoughts on that poll. Oh, only the... So a couple of questions regarding the screen. Did the screen come back for you all?
It did for me.
Came back for me too.
Great. Thanks, guys. I've got the feedback now. Interesting with all these different windows that are up on my screen trying to manage all of this. So this is very interesting from a technology perspective. So we identified that Maureen was doing a process measure of what was being captured through their reception process of updating the primary physician field. The team had predicted that using a script would increase the rate of those updates. So Maureen collected some measures, and she decided that she would establish a baseline measure in week 1. They had recorded 13 of 25 records had been updated. In week 2, also baseline, 15 of 25 records were updated. And then for the following 3 weeks, after the scripting had been in place for reception, they'd recorded 15, 18, and 18 records being updated in those weeks. So Maureen plotted these on a line chart and gave them to the improvement team after the week 3 or week 5 of data collection. And the question that she was putting forward is, does this chart demonstrate an improvement?
Hi, is it possible for us to just look at the graph again?
Oh,
Thank you.
That's okay. We'll close the poll. That's okay. It's better to have the discussion here. So we'll take a look at the graph. And do we think that this indicates some form of improvement? Yes, no, or not sure?
Okay, I heard a yes. Anybody else?
Yes.
And then from the polling perspective, we had a no. So we have a dissenting voice. So as the improvement team met and discusses those findings, they were pleased to see an improvement in the process and agreed to adopt the process and continuing measure for a broader implementation, when the improvement facilitator interjects and states it might be too early to make a decision on this PDSA and suggests that stratifying the data because there may be an early signal related to too few runs. So if we look back at that chart, run chart, we had said that it might be too early or so unsure to detect any improvement at this stage related to too few data as well as runs, which we're going to talk about a little bit later. So the decision was that they would go back and review their data collection process to see if there was other information that could help answer that PDSA question. And they reviewed the individual results from the day, and the improvement facilitator suggested that they create a run chart by day of the week to see if stratification is indeed necessary. And this was the run chart that was created when they mapped the updates by day of week. Anything that would stand out when viewing this graph? All right, so first we would note that there is no line between points 20 and 22, and that is an example of when data is not collected, we do not put a point on the line, and as well, if the answer is 0, we do put an answer and let it be charted on the run chart. And the chart overall demonstrates some variability with lots of runs, which we will talk about, which June, I think, will talk about later in the presentation. But the improvement team reviewed the data and they found that Mondays and Fridays, their process for updating the record in the EMR was different than it was for Tuesday, Wednesday, and Thursday. So they had a discussion with Heather, the receptionist, and they found that on Mondays and Fridays, she's so busy that Pat, the MOA, helps out by rooming the patient and marking the patient as arrived. The improvement team adapts their PDSA to verify the primary MD during the appointment booking process. And following through into the implementation, the confirming of the primary MD and updating of the EMR at the time of booking has improved for Dr. Doe, And so they tracked his measures and decided that it would be best if we created an implementation or a spread plan, and they were going to work with the same receptionist to work with the other physicians who she books for, Dr. Green and Dr. Black. And following that, then they would then work with Doreen, the other receptionist, to ensure a successful implementation. To determine whether or not they were successful with that, the improvement team had tasked Maureen to generate a run chart for their implementation.
So I'll take over for a little while here. So Maureen came to me. I'm going to be the improvement facilitator who's working with Blue Meadows, and she has seen some of the data on these charts, and she's asked now to take some of this new data and put it into a run chart. She's not really sure what this is. So I explained to her first that a run chart is a basic tool for displaying data in a time order, and that it can be useful in evaluating how a process is working over time. Next slide there, Mark. So I tell her that there are 7 basic steps to constructing a run chart, and I'm going to take her through it. And I'm also then going to let her know that we've been doing other PDSAs within the clinic, and we have been looking at the number of vaccinations that are being offered for flu for one of the physicians. So I'm going to take her through these steps, and then I'm going to give her some concrete examples. So you can see here on the slide, step 1 is to state the question that your run chart is going to answer. And as Mark alluded to before, you've got to choose the correct measurement to prove what or disprove your theory about what you can do that will make a change. So keep in mind, developing your question and deciding what measurements to collect. Your data should help you understand your current performance, come up with some ideas of how to improve that process, tell if the tests of change have led to an improvement, or looking at it afterwards ensure sustainability of your improvements. Hello, who just joined us?
Hey, Josephine, sorry, I'm late.
Oh, hi, Josephine. So step 2 with making a run chart, develop your horizontal axis on your scale, and that's usually your time scale. And it can be in, or most commonly, is done in days, weeks, months, years, but it depends on what you're collecting. There could be other increments that you would use. It's recommended that you label several future time increments beyond the data you're collecting. So, you know, if you're going to do this for a month, you would probably put 6 to 8 weeks worth of hash marks on there to cover that time period. Okay, Mark? Step 3 is developing the vertical scale for your run chart, and it gives you some very good tips here. A good scale is one that's easy to plot, easy to read, leaves room for future data that might be larger or smaller than the values used in your initial run chart construction. So again, you know, your week's worth of data shouldn't take up your entire run chart. Most of the data should lie in about the middle half of your graph. Your label values on the axis should be round numbers, so you don't get into, you know, decimals and fractions. Your on-label hash mark should be easily plotted in red, and you'll see an example later on. And your completed chart is usually done on a ratio of 2 to 5 vertical to horizontal ratio. So when you do your hash marks, and again, you'll see that in the example that follows. Next slide there, Mark. And then you plot your data points, of course. Make a dot where your data point lands. You can connect the dots, but make sure your dots are distinguishable because your data is communicated through the dots and not the lines. And of course, you label your graph with a useful title. Thinking that if you're doing multiple PSAs in a clinic as well and you want to look back and find something that you've previously measured, you know, it's really useful to have the graph labeled not only what measurements are included in there, but sometimes when you ran them as well. So if you're going to run the same test of change again next year, you might want to have the year written in there. So again, you put your horizontal axis. Oh, sorry. There you go, with your time sequence and your vertical axis with the name of the measure that you're studying. And 6, you calculate and place a median on the run chart. And the median is very interesting because most people, the first run chart they make, they tend to want to average it out. But what it needs to do is take the set of measures that you have, order them from highest to lowest, choose the number that's in the middle of the data point, and that's your median. If you do an average, that gives you a different measure that's called the mean. That's not the median. And once you put in your median line, there should be an equal number of data points above the line as below the line. You don't count ones that fall exactly on the line. And step 7, you add any additional information to the chart to make it more meaningful. And again, as Mark stated before, you might have a goal or a target line in mind. You can certainly put that in. I usually color it something differently than I colored the median line. If you annotate unusual events, it's helpful if you're looking back. And you'll see in the example later that we wanted to note if there was a change that we made. Mark's previous example, they started using the script, and he annotated in there so that they'd know if there was drastic change in their measures after that point, then it's probably attributable to the change they made. You don't want to put in so many annotations that it clutters your graph and takes away from how easy it is to read or from the importance of the data that you have there. Okay, Mark. And so, the Blue Meadow Family Care Clinic has been measuring the number of patients in Dr. Doe's panel who've been offered influenza vaccination during the open clinic hours, Monday to Friday, 9 to 5. So this is the example that I'm going to show Maureen now of the PDSA that we've been running in the clinical end of the Blue Meadow Clinic. So they started measuring right after their flu vaccine was delivered from health services, and we're pretending that that started October 1st of 2013. They previously agreed that the vaccinations, once they were given, would be noted in a particular place in the EMR, and the EMR would be able then to accurately search for those who received the vaccination, but we also wanted to measure the offers for ASaP. So they might be noted in the chart notes. We could put them on a list or a tick sheet. And we agreed that the inoculations would be offered opportunistically. So for every patient that came in to see Dr. Doe after those vaccines arrived in the clinic, no matter what it was for, we were going to offer them a flu vaccination. Okay, Mark? So what question do we want to pose about that, and how are we going to answer that question? So the question for the run chart with this example would be how many patients of Dr. Doe's are offered a flu vaccination on each clinic workday. The data has been collected by the person who's offering or giving the shots, because we're assuming if the shot was given, then the offer was made and accepted. And they decided to put a tick sheet over so that the person offering, who is usually the one rooming the patient, could easily just tick off and count them up at the end of the day. And they've been charting the offers in a specific place in EMR, so that later on, when data is cleaned up, they would be able to count those offers using the EMR. So right now they weren't at that place, but we're starting to try to get some good habits in there working towards a nice clean panel data and charting. Okay, Mark? You can see I showed her now that we drew the horizontal and vertical axes, and they're labeled there. So on the y-axis, it's the number of shots offered each day. On the x-axis, it's our time increments. So there it's days of the week, and you can see we're closed on weekends. So 6th and 7th are missing, and 13th, 14th is missing. There you go. Next slide. And then we had some data that we put in. And I put the numbers by there just so you can see. And if it's not totally accurate, well, I was doing this late at night. So there's the number of shots that we were able to record that were offered to Dr. Doe's patients on those appropriate work days. And we need to label it with the meaningful title. So how could we title that? Any ideas on maybe what we could do? There's some options, another quick poll. So thinking back on what we said would be a good way to label a run chart. How would you label that? Okay, did you get any answers there, Mark?
We currently have no voters. Oh, one voter.
No voters, okay. All right, so I'll just give you the answer then. So it would be Dr. Doe, because we're only measuring him, daily flu shot offers, and fall of 2013. Because again, if we decide to run this through the next year's flu shot season, you want to be able to find and identify your run. Okay, next slide. Then you plot your median. So again, if you listed all of those numbers in a row, lowest to highest, pick the middle one, the middle value, it would be 40. And you can see when you plot the median, so we don't count 40 because the median line goes through there, and we have 3 points above and 3 points below our median line. And we've annotated. So when we looked at it, we did poorly at the beginning, the very first day, and it was a new process, and we forgot to make up a tracking sheet, and so things got all messed up, and that's why we didn't do very well. Then we started doing a little better, but somebody was sick, and we called in one of our part-time fill-in nurses and didn't tell her about the new process. So somebody who was regularly at the clinic was counting some patients they were offering shots to, but the fill-in nurse wasn't. So again, you can see where it's important to make those little notes if you do really well or if things fall off a bit, so that you know what happened that affected the data at that particular time.
Great. Thanks, June. So with your advice on how to create a run chart, we're using some very good recommendations and guidelines, Maureen went back and started to create a run chart using the updated primary MD field for their providers for their implementation. And she brought back this to show you, to say indeed she's taken your advice to the best of her ability, and was wondering if you might have any suggestions for her. So I'll let you review the chart here for a few seconds, and then I will put up another poll, and you can select as many recommendations as you would like, and then we'll open the line if there's any suggestions that we didn't include in our poll. All right.
The graph again when you put up the poll.
I see that, so we'll have to contemplate that next time, June. So if there was any recommendations from what you recall, you can go ahead and tick those on the poll. And then we'll close the poll and we can have a discussion to see if there was other things that people would think about. All right, I'm going to close the poll and bring us back to the graph. And so consistently, you identified that this graph was way too busy and that it would be valuable to have it broken down in some way that made sense. So some of you identified putting each provider on their own graph would be important. Others said perhaps a grouping based upon the receptionist might be appropriate. Somebody identified that a median line was not apparent but might have added to the busyness, and then a few others had decided that a bit more detail on some of the PDSAs might be helpful in interpreting this chart. So I'll open it for any other words of wisdom from the audience around making this a more useful run chart.
The one value I see in this graph is you can still that there's significant provider-to-provider variation, so you can tell the standardization piece definitely hasn't come together yet, so there's value in at least seeing that lack of consistency, but then otherwise, yeah, break it apart and start to identify your individual pieces.
Thanks, Noel. Thanks, Nolan. It's a great comment because sometimes, if we were to look at these individually, we might not see patterns, and sometimes you have to put the data together in a different way to see a different picture.
I think it's a good example, Mark, too, like you say, of it being too busy. Sometimes you can have so much information on something that the value of it is lost simply in the messiness of it.
So there are some rules that help us analyze our run charts, and we covered a couple of those rules in our training session. And so today we'll go through those rules as well as a couple others that will help us with our run charts. So the first rule that we covered is around a shift in process being signaled by 6 or more consecutive data points all above or below the median. So on this chart here we see that there are 6 data points that are on above the median, starting with data point, I think it's 5. And so this would tell us, or this would signal that the data is telling us that there is a shift in process. It doesn't necessarily mean that it's a statistically significant change, but it is indicating that there's something here that should be investigated. Run chart rule number 2 talks about a trend. And a trend is signaled by 5 or more consecutive data points going in one direction. And in this case, which I'm looking at the example now, and they happen to be all above a median line, so I'm not exactly sure that is correct. So I'm going to apologize that this might be a poor graph, but the evidence of 5 data points all moving in the same direction would be evidence of a trend and something that you would want to investigate either through looking at what activities been occurring during that time frame. Run chart rule number 3, too many or too few runs, which signals a non-random pattern. So a run is the data points that consecutively lie on one side of the median. So in this example, there are 2 runs, and they can be identified as a run on the left-hand 6 data points and on the right 6-hand data points. So a run ends once that line crosses the median, and we do not count data points that land on the median. What this would tell us is that there is a non-random pattern, and we might need to do some further investigation, such as stratification. So sometimes we may see this type of a run chart, and if we're looking at large amounts of data that's been aggregated, and there's only a very few runs, it may indicate that you need to break the data down to have a look at it, like we did in our earlier example, where they were aggregating an entire week's worth of data, and they did not have many runs, but yet when we broke it down and stratified it by day, we could see that the data was trying to tell us something. Chart review number 4, rule number 4, an astronomical data point. This is a point on your chart where there is something that stands out even to a child, that this does not quite make sense and is worthy of investigating and then annotating your run chart. So looking back at the Blue Meadows Clinic, for their flu shots that June was working with the team on, what does this run chart suggest? Is there anything that we can draw from this run chart at this point in time? And I'm going to assume by the silence or the thought on this that it's either difficult to understand, or that you're unsure, or there's not enough information.
This is Nolan, I guess, because I'm just not feeling shy today. I think given the rules you presented it would be difficult to say that there's a clear change, but visually it does seem to have that trending of a division where the earlier points are below the median, the latter are above. So, I mean, continue to measure, but I would consider the trend to be significant here.
Absolutely, Nolan. So thank you for your comments. It's there. I mean, the rules are posed as guidelines, and so sometimes you can look at this as a picture, and sometimes the rules help us in interpreting it. But sometimes there's a period where we just have to look visually at this and say there's something that's different that's happening as a result of some of the trends. And I agree that right now this would probably be early to make any further analysis. However, you might say that there is an early trend and that we would continue to monitor or continue to collect data.
And then, seeing as this is a process measure, my next question would be, what's the ceiling of this? What is the number of people that doctor observes, and are we close to that threshold? Does he see 200 a day where we're only at 25%, or does he see 50 a day where we're really knocking it out of the park?
Yeah, absolutely, Nolan. So recognizing that exactly this is a process measure, and sometimes when we look at our scale, sometimes we have to be cognizant of, are we measuring numbers, or would it be more valuable to measure in percent? So was this 10% of the patients who were seen today moving up to 50%, or sometimes do we need to have both, where we need to have a percentage of the patients and the number to track for those days where it might be a lower activity day. So those are all great considerations when looking at how to present and interpret run charts and data.
Or Mark, would it be appropriate then to have a target line, as we talked about earlier?
Absolutely. This would be an example where we could put that in, particularly if we knew what the expected activity during October and November of 2013 would look like. Absolutely, June. So in close of the kind of the more formal component of this, there are some resources that are available to you. Again, we promoting the IHI Open School, which all of you should have access to. And I know that in Chinook there are a few people that have joined us today. And if you do not have access, please contact me. We'll make sure that we get you connected to the IHI Open School. And here are some of the modules that would be in support of your learning around measurement and run charts. So I will put up our last slide, which could be to have any questions that we can attempt to answer. And then also as a reminder, we have the Yammer account where we can have a further discussion about measurement and run charts, the value of process and outcome measures, etc. So I'm going to pause here and open up the line for questions. And just because it's Friday and I suspect everybody has other plans that they'd like to be getting onto, I'm going to pause even a little bit longer. Great. Well, then I will just welcome your questions and comments through the Yammer account. June is currently our moderator there, and we'll be happy to field your questions and comments related to measurement and run charts, as well as any comments in the webinars in general or other areas that people would like to see further development and further information on. So thank you so much for your time today. And June, I'll turn it back to you if you have any parting comments.
We really appreciate, particularly because this is a Friday on a summer weekend, that you took the time to join us today. We'd also like to have any feedback about how valuable any of this information and content was to you, and any way, anything we could add or tweak that would make it even more pertinent. So I appreciate it, and if there's no questions, we'll bid you adieu for the weekend.